I'm Janine. Again, welcome everyone. Good morning, and thank you for joining us today. I'm Janine Kuzma, Senior Manager of Gift Planning here at St. Joseph Health Center Foundation, and I am delighted to host this session. Today, we are diving into a topic of eating well and keeping active, and we are fortunate to have with us two St. Joe's experts, Lauren O'Neill and Jacqueline Holloway. They will be sharing their insights and tips to help us all live healthier and more vibrant lives. But before I ask them to join us, I would like to extend our sincere thanks to the Slate Family Foundations, whose generous support and commitment to seniors' health has made this series possible. I would also like to take a moment to acknowledge the land on which St. Joe's operates. This is a traditional territory of many First Peoples, including the Mississaugas of Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples. Today, this land remains home to many diverse First Nations, Inuit, and Métis peoples. We also acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of Credit. Finally, I want to take this opportunity to share with you a few St. Joe's updates and also thank you for being St. Joe's extraordinary supporters. As many of you know, our West End community is growing rapidly. And with that growth comes an increasing demand for more spaces and more specialized medical services. Today, St. Joe's Health Center proudly serves over 500,000 people, providing essential care to meet the evolving needs of our community. Thanks to the generosity of our donors, including St. Joe's Society legacy donors and our amazing community, we were able to create many new spaces. And I am proud to mention two of them. The new Lake House Palliative Care Center, a space of compassion, and the breast cancer screening and treatment with state-of-the-art technology. Those spaces are just a few of many, and they were 100% donor funded. So I want to thank you again for your support and commitment to St. Joe's. But we have so much more to do and many exciting plans for the future, including expanding key areas such as our emergency department, surgical spaces, and mental health care programs. If you'd like to learn more about our future plans, or make a donation, or leave a lasting legacy by including St. Joe's in your estate plans or will, I'd be happy to speak with you. My contact information will be displayed on the screen at the end of today's presentation. You can also see the impact our community is having by visiting supportstjoes.ca. Now, without further delay, let me introduce to you again our speakers, Lauren O'Neill and Jacqueline Holloway. Lauren has been part of St. Joe's since 2008, specializing in nutritional care for older adults. Lauren is a registered dietitian and certified diabetes educator with extensive experience in diabetes education and age-related dietary needs. She offers personalized strategies to help patients optimize their nutrition and well-being. Jacqueline Holloway is a St. Joe's physiotherapist with over 25 years of experience in neurological, cardiovascular, and musculoskeletal care. She works with older adults at St. Joe's Clinic for Healthy Aging and Heart Failure Clinic, using tailored rehabilitation to enhance mobility and improve quality of life. Ladies, welcome.
Thank you so much for the introduction, Janine, and I'd like to really thank the foundation for this opportunity. I'm typically involved with families and caregivers during the late stages of dementia, so it's a real pleasure to be here today to talk to you about what we can do diet-wise to help support and maintain your brain health as you age. So the number of people living with dementia is rising. So this discussion is really timely today. And these are stats from a 2021 World Health Organization report. And as we can see, by 2050, it's estimated that 139 million people worldwide will be living with dementia. And right now, someone in the world develops dementia every 3.2 seconds. Moving a little closer to home to dementia in Canada, in 2022, a report was published known as the Landmark Study. And this report contained a predictive model on how many Canadians would develop dementia over the next 30 years. And we can see from this figure, the number is projected to increase. And this is in large part due to the aging population. At present, in 2024, marked by this arrow, we have around 750,000 Canadians living with dementia, and the numbers are forecasted to reach around 1.7 million by 2050. While these numbers may look and sound quite daunting to all of us, I think the silver lining is that there was a report published in the Lancet in 2020, that's a journal, that showed that almost half of the risk factors for dementia are potentially modifiable. And in 2024, there was an update to the list shown here in the middle of the slide, and 2 additional risk factors were added: high LDL cholesterol, which is our bad cholesterol, and untreated vision loss. And while there's a growing list of risk factors that are labeled as modifiable, I just like to pause and acknowledge that many Canadians may have difficulty or challenges in changing their risk profile due to their personal situation and resources. So the report by the Alzheimer's Society of Canada, shown here on the left, indicates that it really will require a coordinated effort through communities, public health agencies, and governments to reduce our overall risk of dementia. So the focus of my talk is diet, and I'm going to start right off the hop with the key message. When it comes to diet, what's good for the heart is good for the brain. We have long known that the diseases and conditions that clog the arteries of the heart also clog arteries and blood vessels to other areas in the body, including the brain. High blood pressure, high cholesterol, and high blood sugars over time also cause damage to these delicate and tiny blood vessels in the brain and elsewhere in the body. So diets designed to help manage these other chronic conditions are also beneficial for the brain. There are a number of dietary patterns that have been linked to improved heart health and cognitive function, and I've listed those here. Examples are the Mediterranean diet, and this focuses on the traditional foods eaten in countries that surround the Mediterranean Sea. And there's really not one Mediterranean diet because, as you can imagine, there's over 20 countries that border the Mediterranean. There's the DASH diet, which stands for Dietary Approaches to Stop Hypertension. And this was developed in the late 1990s to prevent and treat high blood pressure. And there's the MIND diet, which stands for the Mediterranean DASH intervention for neurodegenerative delay. A little bit of a mouthful, but this was developed in 2015. And this is a combination of the 2 above diets And they took into consideration some additional research. It was designed specifically to support brain function and slow cognitive decline. So while these diets vary slightly in their recommendations, they all share a few things in common. They all emphasize whole grains, whole foods. They limit pre-made, pre-packaged, and processed foods. They encourage a high intake of fruits and vegetables. They recommend inclusion of nuts and legumes several times per week. They emphasize weekly consumption of fish. And they also recommend vegetarian oils or extra virgin olive oil in place of cooking or using butter. Importantly, they also all advise cutting back on red meat, refined grains like white rice and white bread, and sugar. Science and knowledge of diet and brain health is continually evolving. And the research to date shows that adherence to diets like the Mediterranean, DASH, and MIND diets have been associated with better cognitive function, with improved scores on memory tests, slower cognitive decline, larger total brain tissue or volume, and hippocampal volume. And it's the hippocampus is a region of the brain important for memory, and lower odds of developing cognitive impairment and Alzheimer's disease and other dementias. In a 2017 brain health study, people who reported eating well also just generally reported having better brain health. And while people with great health and excellent diets still develop dementia, this research is very encouraging and empowering, as it suggests that we may be able to modify our behaviors to help lower our risk. So it's with this growing compilation of research that diet can influence brain health that prompted the development of Canada's first brain health food guide in 2017. Researchers have found that dietary patterns similar to those described in the Brain Health Food Guide are associated with decreasing the risk of developing Alzheimer's by 36% and mild cognitive impairment by 27%. The Brain Health Food Guide is a 2-page document, and it provides recommendations for adults 50 years and older on the number of servings for foods your brain requires to function best. It also has recommendations on foods to limit and avoid. The guide is available in both English and French, but it has not, to my knowledge, been translated to other languages. And we're happy to provide a copy of the guide to you in a follow-up communication. I'll be reviewing the recommendations with this guide with you today. So the Brain Health Food Guide recommends that you eat vegetables 5 or more times a day. And a serving is a half cup of like a cooked vegetable, or 1 fist of or 1 cup of raw leafy greens. The guide highlights the benefit specifically of cruciferous vegetables such as broccoli, cauliflower, Brussels sprouts, kale, cabbage, bok choy. Rutabaga, Swiss chard, radish, turnip, watercress also falls in this category. And it also specifically recommends eating raw leafy greens daily. Raw leafy greens are high in lutein, folate, beta carotene, and vitamins E and K. And these are thought to be neuroprotective and beneficial for the brain. Among all the different types of vegetables, the green leafy vegetables have been identified as having the strongest protective associations against cognitive decline. And there was one study called the Rush Memory and Aging Project that showed the rate of decline among those who consumed 1 to 2 servings per day of green leafy vegetables, equivalent to being 11 years younger in age compared with those who rarely or never consumed green leafy vegetables. The Brain Health Food Guide also highlights the benefit of eating a wide variety and colorful assortment of vegetables, and fresh and frozen vegetables are equally good options. After harvest, vegetables destined for the frozen food aisle are washed, blanched, and quickly frozen at their peak ripeness, typically within a few hours of harvest. And this slide just highlights the wide variety of frozen vegetable options on our shelves today. There's also a recommendation in the guide around total fruit, and the guide recommends eating fruit 4 or more times per day. And a serving size is a medium fruit, or half a measuring cup, or half a fist of fruit. There's also an additional recommendation to include berries, fresh or frozen, 3 times per week. And this is because berries, such as strawberries, blueberries, raspberries, and blackberries, all have antioxidant benefits. They're also high in something called flavonoids, specifically anthocyanins, and these compounds cross into the brain and can improve blood flow to areas responsible for memory and learning. And they're also thought to be anti-inflammatory. Nuts are beneficial for both your heart and your brain, and the Brain Health Food Guide recommends to eat a serving size of nuts daily. A serving size is a 1/4 cup, or 1 cupped hand, or 2 tablespoons of nut butter. And there's a specific recommendation with regards to walnuts, suggesting that we should try to incorporate these 4 or more times per week. And this is because in the larger studies, when they looked at people that consumed nuts in the randomized control trials, walnuts represented about 50% of the nuts provided. So we just have a little more research with regards to walnuts. But I think likely all nuts are beneficial, and there's not one magical nut you need to focus on. This is a UK study, hot off the press, published in September 2024. And researchers in Spain looked at diets of over 50,000 people in the UK. And they found that people who reported eating 1 handful, or 30 grams of nuts per day, had a 16% reduction in dementia compared to those that did not eat any nuts at all. And this study looked at an 8-year period. Unsalted nuts were also seen to have a more positive effect than salted ones. Legumes include beans, all beans, such as kidney beans, chickpeas, black beans, lima beans, soybeans, and also lentils. And the recommendation is to include legumes 2 times per week, and a serving size is a 1/2 cup or a 1/2 fist. Legumes are excellent sources of folate, also known as B9, and other B vitamins that are essential for brain health. I apologize for the slides. I'm realizing I think my slideshow is on a timer. There is a growing recognition of the value and importance of incorporating foods rich in omega-3 into the diet. And DHA is the most prevalent omega-3 in the brain and has been associated with brain development during infancy and brain function throughout life. So fish is a great source of DHA in our diet, and the Brain Health Food Guide recommends consuming fish 3 times per week, with at least one of those fish servings being a fish that's high in omega-3, such as those listed on the slide. There are some concerns, growing concerns about mercury in our fish supply and the adverse health effects that mercury buildup may have on our bodies. And this is a topic of ongoing investigation. Studies have shown that the demonstrated health benefits of eating seafood outweigh the risks of mercury for most people, with some exceptions being in pregnancy. But if you're looking to learn more about mercury in fish, and if this is a concern, the larger fish, the more predatory fish, are the ones that tend to be higher in mercury, and I've listed a few here on the slide. And there's a wonderful website, www.seafoodwatch.org, where you can learn a little bit more about mercury in fish and sustainability of fish and which fish are higher in omega-3. There's a recommendation in the Brain Health Food Guide to use extra virgin olive oil as your main culinary oil for cooking salad dressings and adding to food, to choose lower fat dairy products, and to limit butter and cream to less than one time per week. They also recommend choosing whole grains over refined grains and limiting white breads. And this would also include white rice and white pastas to one or less per week. Now, to qualify as a whole grain, 100% of the original kernel, so the bran, the germ, and the endosperm, and you can see the picture on the right, must be present. And all grains start out as whole, but it's through the refining process that the bran and the largest part, the endosperm, are removed. When you're looking at an ingredient list, this is an ingredient list for bread, you can look for the words whole in front of flour. So for example, a whole wheat flour or a whole rye flour or a whole teff flour means that it's a whole grain. If you see enriched wheat flour or enriched flour, or it just says wheat flour, then that is a more refined grain, and it's stripped of some of the nutrients. So you can see in this example here, the ingredients are listed actually according to weight. So in this bread label here, this bread contains more white flour than whole grain flour. The Brain Health Food Guide also provides recommendations on what to include less often in our diet. And the typical Western diet is high in salt, sugar, excess calories, and saturated fats, and is not good for the brain. And so it's recommended to limit these foods to 3 or less servings per week. And that includes prepackaged foods and meals, potato chips, fries, pretzels, or other salty snacks, store-bought dairy desserts, baked goods, candy and chocolate, pop, fruit juices, or other sugary drinks, and to also consider limiting red and processed meats to less than 1 time per week. If you need some inspiration for cooking with a specific ingredient, there are many brain health recipe books, and there's also a lot available online. So I've included a link that has some brain health recipes. And also, if you go onto a general database and you know you're looking, for example, recipes with lentils or a certain type of bean, often you can search for that particular ingredient and get some ideas on how they can be incorporated in different recipes. So to wrap up, here are some of the key learnings. We have a lot of research to suggest that diet can impact our brain health, and what is good for your heart is good for your brain. There's no single food that acts as a silver bullet for improving or maintaining brain health. It's recommended that you focus on your overall diet rather than one particular superfood. And it's really the combination of different types of foods and nutrients together in our diets that likely determines the health benefit. Taking steps to improve your brain health won't necessarily guarantee that you don't get dementia, but it can help to reduce your personal risk. And the Brain Health Food Guide is an evidence-based approach for healthy eating and for the aging brain. And if you feel overwhelmed by making dietary changes, please remember that some change is better than no change. And sometimes just focusing on one thing in our day could be trying to add a vegetable to our lunch, if it's not already there, is a great place to start. And that brings me to the end of my talk. So thank you very much. And I'm excited to pass the baton to Jackie Holloway, who's going to discuss the role of physical activity in healthy aging, a talk that I'm excited to hear as well.
Thank you so much, Lauren. That was great insight into diet advice and aging with insight. Thank you so much for sharing that with us. All right. So I'm just going to share my screen now. think, Lauren, your screen is still being shared.
I stopped my share on my end.
Oh, geez. I just get this message saying I can't screen share yet. Okay, there we are. All right, so good morning, everyone. My name is Jackie Holloway. I'm a physio at St. Joe's Health Center, and I work in the Clinic for Healthy Aging. Today, we'll talk about some ideas for exercise and keeping active. Our discussions will be thinking about health and exercise and how aging can influence these aspects of our lives, some physical changes that can occur with aging, some safe exercise recommendations, ways to prevent injury, beginning exercises if you're just starting out, and some advanced exercises. So today we're having this discussion with the realization that some things might not be as easy as they used to be when we're younger. But we must keep in mind that there are things we can do to optimize our abilities and keep strength, keep active as we do exercise. So as a physio, I'm here to answer some questions similar to how to exercise safely and how to exercise if we have health-related limitations. Thinking about aging in general, a physiotherapist can prescribe safe and appropriate exercises for people with health concerns. Our training involves studying anatomy, so the structures of the body, studying physiology, how these structures work and interact, and also pathology in terms of disease processes and injuries and how this impacts the systems of the body. So with that in mind, aging is a dynamic process. Ongoing factors might influence our experiences, but we can slow this process. And learning about nutrition exercise today is an important step in aging with insight. Okay, so there's more and more studies that strongly suggest that exercise, specifically aerobic exercise, can preserve cognitive or your thinking functions and reduce dementia risk. So this goes hand in hand with your diet considerations. So exercise is a strategy to slow these age-related declines and reduce disease-related cognitive impairment. With physical exercise, we can target the modifiable risk factors for decline, and physical exercise itself can actually activate the neuroprotective mechanisms to reduce decline with normal aging. So similar to the diet and food impacts on your life, exercise can give you that benefit as well. So what we recommend is a program that's structured, individualized, and studies show sometimes a little bit higher intensity, longer duration with multiple components. So balance and strength, flexibility. These are the things that show the most promise for preserving cognitive performance in adults as we age. So let's look at some specific changes that might be occurring that affect how you feel when you're moving or active as you age. There can be a decrease in general strength and power. You might lose actual skeletal muscle mass. Your muscle tissue becomes less flexible, more rigidity. So this is occurring because of the cross-linking of fibers that makes the joints stiffer, and a lack of exercise can accentuate these normal effects on the tissues. So not to worry, we have a way to counteract this with exercise. Muscle strength will increase when you do resistance exercise that challenges you beyond what you might normally do in your everyday activities. So for example, if you're carrying a 5-pound bag of groceries in from your shopping, when you're thinking about doing a strength exercise, you want to use a similar weight to train those muscles that you might lift the grocery bags with. So if you work with less than 5 pounds, then you're not getting that challenge to the muscles that benefit with resistance training. Exercises for flexibility will keep the joints moving, and specifically when you move your ankles, your knees, your hips, these are the movements you need to be able to step forward, step back, side to side when you're adjusting to uneven ground on the sidewalk, or if there's things on the floor in your home. These are ways to prepare for catching your balance. So bone density, to halt the loss of bone density, weight-bearing exercises are recommended. Stimulus of the muscles actually pulling against where they're attached to the bones, that enables the renewal of the bones. So the surface activation gives you denser, stronger bones. So that's how muscle activity and strength can really benefit your musculoskeletal system. Thinking about posture and balance, you can see having an upright posture just gets you in the right starting place to do exercises safely. So think about posture when you're standing up, when you're sitting down in a chair. It's very important to think about posture as your starting place for balance. Poor posture, maybe when the shoulders or head are leaning forward, can sometimes develop over time. You might notice when you look in the mirror. So this pulls your stability a little bit off balance and you're leaning forward. So you can slow this sort of change with some exercises for your posture and upright strengthening. So balance and coordination exercises. Practice activities on various surfaces like soft foam, a rug at home, or something little different edges to step over, grass, different environments to practice your balance in a safe manner is a good part of balance training. Posture when you're walking can be enhanced sometimes if you might want to use a cane to keep yourself upright and strong. Coordination is important as well, because the brain will practice processing all the things in your busy environment and enable you to practice these things ahead of time so you're prepared. Your muscle memory is built for moving in these environments. So practicing to move with correct balance, you're practicing to adjust to different destabilizing forces. When you strengthen the balance muscles and keep the joints moving, these all prepare you to more easily recover if you're off balance. So these are the key principles for keeping moving well as we age. In addition to the musculoskeletal system, there's some changes in the cardiovascular system as we age. So it's important mostly to reduce sedentary time, moving more, and set aside time for exercise, and that will incorporate breathing and aerobic exercise. This is due to the issues with your cardiovascular tissues. You might have decreased elasticity in your lungs. The muscles you use for breathing, they can actually weaken as well. These muscle systems are what creates the energy we need to move. So keeping health with your lungs and your heart are key to keeping moving well. Okay, so as I mentioned before, thinking about reduced sedentary time, breathing exercises, aerobic type exercises where you're using the larger muscles of the body in a repetitive fashion, such as walking or cycling or swimming even. Any activity that you find enjoyable is a good cardiovascular exercise. So thinking about these systems that are changing as we age, empowering yourself to age with insight occurs through learning about these benefits of exercise, all the factors of balance and coordination we've discussed, and also sometimes thinking of ways to compensate if you have difficulties or health concerns, to make sure you're safe and mobile and doing your activities that you like to do every day and enjoying your life. So learn about support groups for particular medical conditions, if there's anything that affects you specifically in terms of health. And these groups can really have some great suggestions for activity and exercise and a community of support for issues you might have. Thinking about exercise, enhancing your health is just one way to focus on things. So general recommendations. The guidelines recommend 150 minutes of moderate intensity physical exercise each week. So that might equate to 30 minutes, 5 days a week. So it's not an enormous amount of time to dedicate to moving and activity. This is more the focused activity. Maybe you've put aside some time to do this and challenge yourself with a bit more resistance for strengthening, focusing on the exercise. And this might be in addition to your everyday activities and having less sedentary time. So these are the 4 components that are maybe most important for exercise: aerobic, resistance, range of motion, and your balance training. Okay, always thinking about safety, because there might be concerns. How do I avoid injury when I exercise? Or if I'm starting to exercise, how much do I do? So keeping safe, preventing falls, and getting some tips on how to maintain safety is very key. So a summary of some tips: as we mentioned, good posture puts you in a good place to start your exercise. Thinking about keeping your core muscles for stability. So your abdominal muscles across the front of your body, they can really support your back. A lot of people have back pain sometimes, so having stronger abdominal muscles can really help to protect your back. So not necessary to try and do sit-ups and things. Those are more challenging exercises. You can activate your abdominal muscles just simply by tightening the tummy muscles and thinking about the posture. As you're doing this activation of your abdominal muscles, you can do some deep breathing, keeping the air expanding, and that actually strengthens those muscles, the diaphragm at the bottom of the lungs. Remembering to reduce sedentary time, so stand up, change position, walk, move around regularly. Okay, and specifically fall prevention. That's an important aspect of exercise and physiotherapy. So some issues are having bright lighting, clear clutter, use your handrails on the stairs, be safe and careful on the stairs, having extra equipment, say in your washroom grab bars, shower seats. Have something within reach to be able to get help if you need to at all times. If you use a cane or walker, if that's recommended, it can be really helpful to continue to use that when, especially if you're feeling tired or not as well from day to day. Wear your glasses, hearing aids, that input helps maintain balance. And think about safe footwear as well. When you're moving, transitioning from lying to sit, go slowly, sit for a while, get adjusted. So if you don't move too quickly, then you avoid getting dizzy. Thinking about having the geriatrics team, our great physicians here, reviewing your medications and other health issues can help prevent falls. So always ask for help if you are concerned about falling when you're coming into the hospital for an appointment, or if you're out and about in the community, don't be afraid to ask for help from helpful people. Okay, specific exercises. Thinking about the principles of walking, thinking about stretching. You want to move the arms and legs through a comfortable range of motion to maintain what you have. A gentle stretch will move slightly beyond that. You're moving slowly and carefully to ensure no injury. Strengthening, as we mentioned, this is just sort of like a summary. Add a little bit of gradual resistance to progress, increasing the load, increasing repetition. Balance exercises, things you can practice at home, leaning on your kitchen counter, practice standing on one foot, practice standing with your feet close together. These are all ways to exercise. If you're already an experienced exerciser with a number of years of training and things like that, you've been working in sports or enjoy recreational sports, you can progress still from here. You can walk in intervals with faster or quicker times or incline, balance on different surfaces, incorporate more coordination, Tai Chi activities like that. And you can combine your resistance training with balance exercises. Okay, so that concludes the physiotherapy topics I have for today. So if you have any questions for either myself or for Lauren, please feel free to enter them into the Q&A or into the chat, and we will try and address the questions you might have for us today.
We have one question from CG. The question is, I have been reading about sourdough bread being more beneficial than white bread. Is that true? If so, does it need to be the sourdough without the yeast?
Okay, thanks, Amrita. So sourdough, for those of you that aren't aware, it's a slow fermented bread. It actually doesn't require commercial yeast to rise because it's the fermentation process that causes the rise. And it is lower in glycemic index. So for people with diabetes, sourdough, the carbohydrate, which breaks down into sugar, you get a slower rise in your blood sugar with sourdough compared to sort of a standard white bread. So it is very low in glycemic index, similar to a bread that's whole grain. The sourdough bread also, just in general health, it's also good for our gut bacteria. It contains prebiotics. So prebiotics are sort of like the food and fuel for our gut bacteria, and probiotics, which is healthy bacteria for our gut. So good for a few different reasons.
Great. We have one more question from CG, and it's about they've been reading about resistant starch. Is it true that by cooling potatoes, rice, and pasta, that it is better for you?
Yeah, so there is some truth behind that. What happens when you heat foods, the original structure, the bonds are sort of broken and it becomes more rapidly, it more rapidly degrades into sugar. Okay, so that starch turns into sugar faster. But when you cool the food, and there's been the most research in potatoes, when you cool certain potatoes, those bonds strengthen, and it increases something called resistant starch, and that slows the breakdown of carbohydrates into sugar. So again, for people with diabetes, sometimes you could eat the same meal. You might find when it comes straight off the stove, it affects your sugar a little differently than when you have it for leftovers the next day. And actually, there was one study that I read that cooling reheated potatoes actually reduces their GI index by about 30 to 40%. So it does really impact how quickly the carbohydrates break down into sugar.
I think one more question for you, Lauren. It's from Terry, and Terry's question is, does hummus count as legume?
Yeah, I would count it because hummus is made from chickpeas. So it's just a form of chickpeas. And then often there's tahini added to the hummus. But hummus can be a great way to get those beans in.
Okay, sounds great. There is one more question for you. What is the final word on coconut oil?
Yeah, okay. So there was a study that came out, I think more than 10 years ago, or there was a lot of hype, I guess, around coconut oil. But we don't have, so the theory with coconut oil is that even though it's high in saturated fats, that the molecule is a little bit different than the saturated fat that you would find in, for example, beef or red meat, and that there may be a benefit of coconut oil. However, I haven't done a recent literature search, but we didn't have the science to back that up when there was all those claims. And there have been studies that showed that people that had the majority of their added fats coming from coconut oil did have higher LDL cholesterols and sort of a worse lipid or fat profile when they did blood work when you compare it to olive oil or other vegetable oils. So I think, maybe the jury's still out. We might learn more with more research, but right now we don't have any evidence to sort of support changing to coconut oil. And there's some research to support that there could be a risk in doing so. I always say if you like coconut oil in the odd dish, maybe a Thai dish, or you use it as a moisturizer or in some select dishes for flavor, no concern, but I wouldn't make it your main culinary oil.
That was a great question. I was interested to learn about coconut oil too. I had that question on my mind. Thank you for the question.
Thank you, Lauren. We have another question from Terry, and I think that's for you, Jacqueline. Do you recommend stair climbing for cardio, or is that too dangerous?
That's a wonderful question. The stairs are very accessible, especially if you have a two-story home. Having the railings to hold on to is probably an important part of staying safe. If you feel like your balance is giving you any concern, it might be good to ask for an assessment, maybe with a therapist, or even to speak to your doctor if they have any concerns about training on the stairs. Going up and down stairs is a great exercise. One concern might be potentially if you have a cardiologist and you have any heart problems, if that challenge brings you to a point where you're feeling quite short of breath, quite uncomfortable. So you can look back at the safety tips in monitoring how you're feeling when you exercise. That's one of the key points. Do you feel like the exercise is giving you a little bit of a challenge, but not causing any discomfort or concerns? So sometimes knee pains can affect your going up and down the stairs. One little tip is with the sore knee, step up with the opposite knee. So up with the good, and when you're going up the stairs, bring the strong leg up and bring your sore knee to beside that foot and continue like that. And when you're going down the stairs, think about down with the bad. So go down with that sore leg and then bring your stronger leg to it. Those mechanisms just help you negotiate the stairs a little bit better if you do have pain. But in a nutshell, stairs is a great way to do some cardiovascular. Just don't overdo it. And enjoy your exercise if you're going up and down the stairs.
Great. One more question for you, Jacqueline. Which is better, a walker or a rollator?
All right, so those are two great assistive devices that can be helpful in different situations. So describing a standard walker, maybe you've seen them before. It's an aluminum sort of folding thing. It's more generally used inside. It's not meant to go outside on different levels of terrain. And this can be great to have in your home for your everyday walking function. inside the house or inside your apartment. A rollator that has a handle with brakes, and there can be a seat. You can have a basket to carry things in, so that can help you function maybe outside of the home. You can also use it indoors as well if it fits. So the purpose of your walking might dictate which one you prefer. Also, it can be a little more difficult if you have arthritis pain in your hands to control gripping the walker brakes. So those are all things to consider when you're choosing a walker, and a physiotherapist can help you to decide which one might be safest and best for you.
Great, thank you, Jacqueline. I think we don't have any more questions. Oh, there's one from Erica. It says, I have a right bad knee. In which hand should I hold the stick?
Okay, that's a great question as well. Often we recommend that you hold your cane in the opposite hand. That allows you to lean a little bit away from the sore knee. So you're reducing the weight bearing through that sore leg. That's most commonly what we recommend. Some people might be accustomed to using their cane in the same side as a sore knee. If you feel like it's difficult, it makes you more off balance to hold it in the opposite hand. Go by what feels safest for you. And again, you can ask your geriatric doctor or your physiotherapist to help you with the correct use of your cane and the correct height of the cane as well for best posture and walking. Thank you for that question. That's great.
Okay, one more question. I have arthritis in my pointed finger joint. Any exercise you would recommend?
That's a very common concern, having the arthritis pain and maybe even swelling in your hands. So sometimes to help with stiffness, you can have warm water running over your hands, maybe at your sink, massage gently. You can take a sponge that you might have at home, have warm water on the sponge and squeeze the sponge. You can squeeze it with the fist, the fingers, moving around. You can do a little bit of massage of the finger joints. These are all things that can assist with the pain. And also speak to your geriatric physician, and they might recommend a rheumatology expert that they can further help you with those sort of concerns.
We don't have any more questions. Okay, so I think that's all we have time for today. Over to you, back to you, Janine, for a few closing remarks.
Thank you, Amrita, and thank you, Lauren and Jacqueline, for very informative presentation and for giving us great tips to live a healthier lives. Before we wrap up, I'm excited to share that the next virtual presentation in the Aging with Insight series will take place in February 2025. We will be exploring cognitive health and aging well. To register, visit supportstjoes.ca/agingwithinsight. As we approach the holiday season, on behalf of St. Joseph Health Center Foundation, I want to wish you all a joyful and peaceful time with your loved ones and a very happy and healthy New Year. Thank you again, and if you have any questions or comments, please don't hesitate to give me a call, and see you next year. Thank you so much.